All right. Well, hello, everybody. I'm Dr. Kale. We're here in the Breast Podcast Ever. I'm here with Heather Vincent, and we're going to be talking about revision surgery, but also we're going to be talking about just kind of her overall experience with the reconstructive process. So, Heather, thank you for joining us today. I really appreciate it.
Thank you for having me.
All right. So tell us about your diagnosis. Um, what you were experiencing when you were given the diagnosis and kind of the initial steps as you started the reconstructive pathway.
So by the time I had found I had breast cancer, I had already what felt like I had lived through multiple traumas. So my mother suddenly passed away in April 20 of 20, right as we're coming out of the pandemic. So I dealt with that. And then about 15 months later, my husband and I separated. We had been together for 16 years. So I lost a parent, then lost a marriage, and then 4 months later, I was diagnosed with breast cancer. So I I think I was really numb by the time I had gotten that diagnosis. So I kind of just went into hyperspeed as you do when get your first diagnosis. And you just kind of power through. Um, but even when people learn my story and I start talking about everything I've been through, of the three, losing my mom was still the hardest. And I know
Oh,
that's
sure.
crazy to talk about when you talk about cancer, but just how she passed and when she passed, it was just the hardest. So I would say by the time I got breast cancer, which sounds ridiculous to say, I was just like, sure, let's do this.
Yeah.
Um, so I actually discovered it myself. I was doing self breast exams at this point because I had actually two high school friends that had just been diagnosed with breast cancer themselves. So I was a little bit more aware of my body at that point, and I had noticed something around the beginning of December of 20, and I was like, well, I'll clock that because there was a little bit of a pain that I didn't typically feel during my menstrual cycle and stuff like that. And then by the time Christmas hit, I was on my period, and the pain, they talk about a pain, and it's a different pain than you typically get. It was an isolated, very painful spot. And so I said out loud, as if I was talking to my mom, and just said, I will go get this looked at after Christmas. And then the rest is history. I went in for my gyno, and we did the diagnostic. And then 2 weeks later, I had my triple negative stage 2 breast cancer diagnosis.
I have to be honest, I don't remember us talking about any of these things when you first came in to see me. And it makes sense now in retrospect, just, you know, exactly kind of how you processed everything. So, that's a lot. That's a lot to go through in just a little bit of time. Um, so, with all this going on, how did you then decide the type of reconstruction? How'd you decide that, reconstruction for you, given everything that was going on, that was the right thing to do, and then the type of reconstruction that you chose?
For me, I knew I was, I've always had natural large breasts, and have never had a desire to have implants. So I kind of knew going into it that if that was the route I had to go, I would have gone implants. But I had these other options to go through that would be more natural feeling, and something that would last a bit longer. I wasn't interested in having to do a replacement of an implant or anything like that. So I just knew for me, I wanted the most natural. And then also, obviously, I have this in the back of my head. Well, crap, I'm going to have to enter the dating world eventually if I want to ever find my person again.
Yeah.
So I also had that in the back of my head of like, well, what is this reconstruction story going to even be like now that I'm newly single and going to have a double mastectomy? So um, I think once I learned about DIEP flap, that was top of my list for sure.
Okay. Now, tell us about the conversation about saving your nipples, not saving your nipples. Was that something you were thinking of? And once you started to have the conversation, how did you make your choice?
That one was a hard one because if anybody's gone through this, you have all those people that are like, oh, so and so got cancer, and you hear all these stories. Well, of course, the second I'm talking about whether I should save the nipples or not, everyone's like, well, I know somebody that had cancer that came back in it. But for me, I knew I was a lucky one that I did get the option to keep my nipples. Um, and I also feel like there was a bit inside of me, and I felt it because I did have larger natural breasts. I wasn't even sure if they would make it through um, as well. And I just knew if I could, I wanted to. But I also knew if I woke up out of a surgery and they weren't there, I was fine with that mentally because I've already kind of processed all of that. So,
Okay. So walk us through kind of the next steps in terms of the mastectomy, the reconstruction. Walk us through that. Let us know kind of how you felt during that process.
so I went through, I had triple negative. So I had 6 months of chemo. So finally making it through there. And then I had a couple phases. So I had the nipple sparring first with the lymph node removal. And then what was supposed to be 2 weeks later was supposed to be my full double mastectomy with deep flap reconstruction. Well, about day 10 post my nipple sparring and lymph node removal, I had what my doctor, Halla Harvey, says her top three worst hematomas she's ever seen in her life.
Sure.
Um, in my right breast, which is also my cancer breast, I lost a lot of blood. I had to go into an emergency surgery 48 hours prior to the double mastectomy. Uh, so that kind of pivoted the reconstruction path. I will never forget, you probably don't remember, but I will never forget your face when you walked in that room that morning to prep me. And I don't know if Halla Harvey had told you about the hematoma yet or what, but I will never forget, your face was just like, okay, give me a minute and I will be back.
I remember. I remember.
So I kind of knew going into that day that something wasn't going to go as we planned because who was planning that awful emergency surgery where I lost a lot of blood.
Right.
So we had never had the conversation about expanders. So you walked
Right.
back in with a plan of action. And I think this goes into trusting your team and trusting your doctors, having your best outcome for you in mind because you guys laid it out and were basically said, like, you won't make it through this deep flat reconstruction today. Like, my blood counts were already entering the double mastectomy, which we had to do at the lowest point that we even would want you leaving a surgery at. So, when you kind of laid it out there that if I wanted to go through it, something worse off could happen.
Right.
Obviously, you choose life. So we pivoted to expanders, which was not a conversation we had even had. So I didn't go into this surgery thinking I was going to have them or even know anything about them. Um, and then I lived with those expanders for 6 months, and that was the longest 6 months of my life, I think.
I'm
But
sure it was. I'm
happy to
sure it
have
was.
survived the
Right.
mastectomy and then to hear I had complete and total response with my chemo. So it was wins after some real big downfalls, but um, just I think for me, going through everything that you go through, and you can't be so set on the like you might want to you know what your outcome is, and like all those little steps you just have to be open with them shifting, changing, and moving a little bit, and just know that your team, that's why it's so important to have a team that you trust, and that has your back, um, because otherwise that would have been really scary, but
Yeah.
I just trusted and God people, my doctors, that they knew what they were doing and that.
Right. Well, I think you bring up some really good points that, for our listeners, I think it's really important to understand, which is, we try our best. We try our best to avoid complications, but they do happen. And, when they do happen, it's certainly can change the course like it did for you. But, it's about sort of managing those complications as they occur. And, in your case, I had felt the expanders were the right thing to do because if we had moved forward, that would require you potentially needing blood transfusions. And, obviously that's not, for most people, if they can avoid that, absolutely. That's kind of the pathway they want to proceed down. But I think, the important point that you just laid out is that even if there are bumps in the road, it doesn't change the trajectory moving forward. And like you were really great, with that conversation, and I sort of appreciate you during that time where we did have to pivot. And so, that was an easy, difficult decision to make. So, so yeah, so
It
you, so
was.
you, yeah, so you made it through. You had the 6 months where the expanders aren't the most comfortable things in the world. So you're getting ready for the deep flap. Kind of walk us through that. Like,
Then we
how'd you
had
feel? What was your yeah?
um hindsight now, obviously going through it differently than what I initially anticipated. I cannot fathom having six drains hang off my body all at once. I know you kind of like forget about it, but if I had had mastectomy and reconstruction all at the same time, like by the time I had made it to the January deep flap, this past I guess 2 Januaries ago now, that was hard. Like harder than like you really think it's going to be. It's like easier and harder all at the same time. Mentally, I was stronger by this time because I was further away from chemo, but I was still in active treatment because I was still on immunotherapy.
Sure,
Um, and I also, with my immunotherapy, I had a little thyroid condition that we were getting under control. So I had still quite a bit going on with my body, but so incredibly ready for that deep flap. And looking back, and when I look at pictures now, because I highly suggest taking photos, even the awful ones, because when you look back, you're like, I did that. So, um, I don't know what to say, but it was hard. I don't
yeah,
recommend if you don't have to, but no,
sure.
I don't regret deep flap. It's the best decision I have made. I even if I didn't move forward with the reconstruction, I was happy with where we landed um, with the original deep flap, and just exhausting thinking about how tired your body is, but you just get through it. The pain level wasn't bad, so I don't regret any of that. But I have pretty high pain tolerance.
Sure.
I would just say the worst thing out of all the surgeries is the drains, and you kind of forget about
So,
them.
so what would you tell? So, when you had the expanders removed and you had the deep flap reconstruction, like what are some like things that you would let patients who are about to go through this surgery, like what are some things that some advice that you would give? What are
Yeah.
some things that like you didn't necessarily know what to expect that after surgery, like, oh, this is what this is like? What like help shed some light on those things.
I would say as much as possible movement, strength training, moving your body, getting your body stronger, because getting through that 4 to 6, I would say that 4 week period where you're really tender in the abdomen, you really want to, and you obviously can't use your upper body, so you really need to have strong legs as best as you can. And so just as much working out as you can. And now, if you go into an immediate reconstruction, you might be a little bit lower, just if you're coming right off of chemo. I understand that. But having my ability to use my legs, just getting up and off the toilet, up and down off the toilet, and because you don't have your arms to help you with anything at the same time. So having a strong body as much as you can, so movement, walking, and then having a good team of support around you to help you with meals, to help you get through those hardest points. Um, those first few showers, especially,
Right.
and just keeping your mind. If you're anything like me, I'm somebody that's go, go, go. I hate sitting. So this was another challenge for me, but um, just really thinking of projects you can do sitting there, just keeping in mind always that this is just a moment, this isn't forever. So keeping that in perspective, that like you will get through this, you will get through this, and staying as positive as you can and having positive people around you to make you laugh, um, you'll get there for sure.
Well, that's great. That's really good advice for people going through it, for sure. Um, so you made it through. You obviously healed and recovered. And
Mm-hmm.
just for those of our listeners who, when we were talking about the bruising at the time of your nipple delay, just want to let them know that your nipple recovered and did well and
Yep.
did great and made it. So you have the deep flap, and then
Yep.
we're in the office again. And this is one thing that, I want to spend a little bit of time talking
Yep.
about with you. And so, also to let our audience know as well, the revision part. So, like, how did you decide, like, I want to have a revision after having the deep flap? What were some of your goals, and how did we had talked about different things, so what surgery did we ultimately land on, and tell us about that.
So I was lucky enough to have plenty of material for us to work with for my deep flap. So I had larger breasts coming out of the deep flap reconstruction. Kind of always knew I wanted to have a lift at some point anyway, regardless of if this had happened in my life or not. Um, so I would say around month 4, 5, and 6 post the deep flap is when things really healed nicely and they started to kind of like feel a part of my body. I don't know how to describe it except they did feel foreign, even though they were my material. It did feel foreign
Sure.
up until that 5 month period. And like
Okay.
I said, I would have been happy with my breast if I were told reconstruction probably won't work. This is probably about as best as they'll get. I would have been happy with that. Um, they healed really nicely. The scars, the revisions, everything just healed really, really good. And I know it's scary when you first see it for month 1 versus month 4 and 5, but it was amazing how great they healed. I also knew that I wanted, like I said, I kind of wanted a little bit of a lift.
Okay.
The nipples did survive, so I kind of wanted them to just be higher because again, we're entering the dating scene, hopefully, right? So I
Right.
would like wanted to have
Right.
the best that I could. Also, knowing that I already hit deductibles, I kind of wanted to sneak in a revision if I could in the same year. So we had talked about a few options, and I thought that all revisions is just fat grafting and liposuction. I just thought all revisions, that's how they worked. I guess in my mind, I didn't realize that we could reshape the flap, move them higher, and give me the lift and the full effect in a full revision. Um, so I actually opted, we did not do lipo or the fat grafting, and we reshaped my flap. And I'll just use a term that my best friend likes to say, but she's like, this really is build. Sorry, I'm going to cuss. But she calls it build a bitch. And she is just so impressed So, um, I just think if you're not happy, you're never going to be happy. So if these are something that you're living with the rest of your life, you might as well get what you want or as close to what you want as you can get. Um, so we basically essentially did a lift and reduction on my deep flap. And I'm so happy.
Well, great. So by reshaping, like what do you mean? Like how would you describe that for the folks that are listening in?
I would say that after the initial deep flap, like how I describe it is they were round, but they weren't round. Um,
Okay,
like off my body. They were more flat when you looked down, but they looking at me, they were round. So I
got
wanted
it.
more of a fullness, I guess is the word I'm looking for. A
Okay,
bit more fuller and a bit better cleavage. Things were a little bit uneven on how um, the flaps healed certain spots, and we did add some additional skin um, around my breasts that we were able to remove in the revision.
okay. Well, good. And I just want, from, a surgeon standpoint, when we do the deep flap, and I may have told you this too, that initial deep flap, our goal is number one goal is to make it work. Our second goal is to make it work. Our third goal is to make it work. And so for those patients that have heard me say that, like I do say that a lot. And the reason being is because at the time of the initial deep flap, we want to make sure that those tiny blood vessels that we're reconnecting, that they stay open and the blood is flowing like it's supposed to. Now, certainly we are sensitive to cosmesis and we want to try to shape as much as possible at the time of the deep flap, but we don't want to do that at the risk of potentially injuring those blood vessels. And so in that revisionary surgery, that gives us, once everything's healed and once everything's settled in, we really have that option at that point to get really aggressive with reshaping. Whereas, at the time of the deep flap, it would be a little bit more difficult and maybe dangerous to get that aggressive. So it's just something, from a surgeon's perspective that, definitely like to put out there. Now, you talked about the drains. What were your thoughts about the drains with the reshaping procedure?
Didn't like them anymore. I would say, obvi- obviously, the worst the drains are the hip ones when you're going through the deep flap because they are so far behind you that it's just
Sure.
becomes after a few days sitting, moving, you feel like you're always hitting them. Um, Somehow I did do better this last round with them. But at that day 7 mark, if those drains hurt and
It's
you
time to
feel
go.
like, yeah, you feel like it's like they have to be doing more damage than good at this point. But
Sure.
um, I, I also feel like with this reconstruction, this revision, I was the healthiest. I was the strongest, both physically and mentally going into this. So I also kind of forgot that I shouldn't be using my arms. Because all the other previous surgeries, I was either coming off of chemo or I was having, I had just had another surgery. So I was physically more tired or drained. But this time around, I had everything about me. And so I kind of had to remind myself that I can't use my arms. And I needed to calm down a bit more. But those drains, I don't have any tips or tricks for those except just get through it.
Yeah. I wish I had a better strategy for it as well too, and they are unfortunately a necessary evil. Um, Now, how would you compare the intensity of the reshaping procedure in relation to the deep flap?
So I don't honestly, physically, this last surgery was the easiest. And I know it was still a 2 or 3 hour surgery that we did,
Right.
but it was like I think it was just the easiest because I was the healthiest, I was strongest, I was working out daily, I was ready to go. Mentally, I was just stayed positive and I was just ready for this next step because I just knew. I remember just looking at, again, take those images, seeing from the initial DIEP flap and then just that 4 month, 5 months, 6 months, and how great they looked and felt then. And I just knew it was going to get better. And
Right.
so,
Now, did it take the same 4 to 5 month period in
no,
terms of after the reshaping?
I feel like by week 4, they felt like the swelling went down immensely. They took a better shape. Things started to settle. And now what? We're almost 3 months out and I love them. They look great.
Yeah. I think you had an amazing result. And are you happy that you saved the nipples? Because I know you had talked in the beginning that you were kind of on the fence about that. What are your thoughts now that you've decided that, yeah, I want to save my nipples?
I'm happy I did.
Yeah.
Yep. No
Well,
regrets.
Heather, it was really just a pleasure to be able to work with you. You were great throughout this process, even when there were bumps in the roads. I'm really kind of, for me, just being on the other side with of the reconstructive journey with you. It from for me, this is what keeps me going. So, and I want to thank you for having your trust in me and the rest of our team, and Dr. Hala Harvey and her team. We were all really blessed to be able to work with you. So, thank you for that.
Got good doctors for
Yeah.
sure. I'd tell them dream team. If you have
Well,
to go
thank you.
through something awful, get some good ones on your side.
Right.
So
Any other tips for our patients that are listening, that you can think of off the top of your head?
just stay off Google, and find your people. I know you might have your people that are your best friends or your family or your husband or a spouse or whomever, but you really need to find a group, a person, even if it's just on social media, somebody that's going through something just like you. So, um, I have found my breasties, as we call them, in various different outlets and ways, but talking to the people that have gone through the journey you've walked is totally different than when you're talking to your friend or your mom or your dad or your husband or whomever. So just find your people that you can bitch about or bitch to, or of all the things you are going through that day, because holding on to it is just not worth it. And that there is light at the end of the tunnel.
Well, thank you. That's perfect advice. So thank you again, Heather. I'm sure our paths will cross, even though we're sort of at the end of the reconstructive journey. But thank you again.
Thank you.
All right.